Hello, my name is Min Tam Lam. I'm a nursing student. I'm going to talk about a workplace bullying nursing, which mean and phenomenon occur among nurses. Presentation, I will talk about an introduction and background of this issue, then moving forward to further consideration and conclusion. The point of this presentation is to understand how bullying is the contemporary nursing practice and also impact on the patient safety and healthy workplace. Secondly, how effective leadership could contribute to determine or reduce this problem and optimize the patient healthcare and workplace safety. Lastly, I will analyze how a new graduate nurse can contribute to resolve this problem through the effective leadership and based on the scope of her practice and legal and ethical boundaries. The World Health Organization 2010, the worldwide development in bullying in workplace add a serious problem to patient and nurse health and well-being, including the commitment to eliminate workplace violence as a top priority. Moreover, my target audience are nursing manager, nursing team leader, registered nurse, and new graduates nurse. So the high rate of exposure to bullying by comparing figures across all occupations in Australia. Based on New South Wales Nurse and Midwife Association report, there are 77% of respondents had observed bullying in the workplace. Generally, bullying includes the behavior aimed at one person to stigmatize and humiliate associately. Moreover, it also targeted at disrupting the victim name and position by attacking the professional, competent workplace and character. Furthermore, new graduate nurses are major impressionable to this issue and face more negative effect than others. In addition, in the workplace, the number of act and attack of the violence nurse straightforward at each other are significant and could not be ignored. It is comprehensible from diverse statistical analysis and study that this condition is damaging for the hospital and facility and alarming for the nurse. According to Nursing and Midwife Board of Australia in 2008, nurse began the nursing profession, including a duty of care to the patient as well as the performance in caring toward each other and mothering consideration and practicing kindness. In Fair Work Act 2009, bullying is identified that bullying is a group of persons regularly behave unreasonably to other workers at work and that behave produce a risk to safety and health. Moreover, it must happen repeatedly, which is more than one, and must impact negatively to safety and health that lead to be paid attention as bullying. Inappropriate behavior, including bully, are being inspected in healthcare in consequence of the potential negative effect on patient safety and workers' satisfaction and well-being. Moreover, unsatisfactory teamwork can contribute to worse patient healthcare outcome. Bullying behavior demonstrate lack of teamwork, negative gossip, and worse a figure it out yourself attitude, and more behind the scene. Workplace bullying in nursing occur due to non-acceptance of different attitude to training, gender imbalance, negative climate, and or closely bond group, lack of experienced staff, limited autonomy in practice, high stress environment, and isolate from the public and other staff. This problem also impact on individually as well as increasing staff turnover. By that means constitute already serious staff shortage and impact patient welfare. Moreover, the consequence of bullying in nursing are not be addressed by safety program and staff health, putting nurse at further risk result in negative impact on healthcare system as dwindling workforce, decreasing professional condition and decades of enrollment and retention. According to New South Wales Health South Eastern Sydney Local Health District, nurses are facing two significant health impacts vary from anxiety, reduced self-esteem and stress to post-traumatic stress disorder and depression. Person-related bullying identifies serious associated with physiological, psychological, and behavioral reaction and medical error. Additionally, in clinical setting, there are some effects on patient as disruptive behavior related to patient mortality, medical error, and considerings about a happen which remove not attention and result in increasing injury and error. Furthermore, it also bring out the negative feedback on the environment such as decision-making, communication, teamwork, and collaboration. The government has taken involved in order to stop this problem as providing some policy and national anti-bullying law and state. The mission has the competence to issue order against employer and individual as too straightforward an employer to improve policy and offer training to fight bullying. 2013, the Fair Work Act creating new standard and particular provision in workplace bullying, which was passed amendment by Australian Federal Parliament. In 2018, the Code of Conduct for Nurse has been published by Nursing and Midwife Board of Australia, which has a particular section on bullying and obviously stating to a zero-tolerant approach. Australian Nursing Federation in 2012 raised some policy to prevent the bullying in workplace. To prevent this problem, nurses are being bullied or observing nurse must voice to managers or team leader, a human resources department, and nurse and midwife support. Moreover, to aware how the workplace fight to the bully, Nurse should read the procedures and policy on prevention of bullying organizational value. Furthermore, nurse should enhance the patient satisfaction, reduce patient mortality and medication error, develop the experience and positive relationship between staff, and provide a sustainable and healthy workplace culture. Relationship between safety and leadership play an important role in providing positive safety outcome for the patient healthcare. Care setting have a strong leadership can result in multidiscipline collaboration, satisfactory staffing level. It's also empowerment to contribute to the policy development. It can make the significant reduce the incident of adverse events such as fall, complaint of care, infection, and medication error. Moreover, the safety culture is one advantage by effective leadership. Leader provide effective leadership, which is positive strategies to preventing bullying, which are based on the quality of working environment. Furthermore, with the effective leadership, nurses not only be empowered to go further, but also beyond their self-imposed boundary to achieve a vision shared by a team leader without afraid of recrimination. For a team member could voice their idea and try to work out in order to prevent the worst situation happen. Moreover, leadership could attract staff to carry about the necessary change, which contribute to unit stand out from the crowd, would develop a level of excellence in patient care. Is a professional which is based on collaborative relationship with college and patient. However, when two or more people view issue from different perspectives, this relationship can be compromised by violence and can result in negative patient outcome. For example, failing to tell another nurse that patient lab result were called to you, refusing to answer other nurse called light because those are not my patient, nurse eating their young or new orienteers, staffing compromise because no one hires day and indifferent or ignoring that doesn't mean I have to do it. The factor for the reporting content afraid of retaliation for being well whistleblower, culture of acceptance and lack of trust in management. As a new graduate nurse, I have to follow the code of conduct, standard for practice, and the core values. According to code of conduct for nurse in domain practice safely, effectively, and collaboratively, there are some principles at a person-centered care. In nursing practice, nurses have to take the leadership role to ensure the provision of quality and safe care, as well as understanding the professional responsibility to protect people, make sure other team members comply with duty of care, and report concern if they consider the practice environment is harming the safety of other people. Moreover, nurses have to realize and work within a scope of practice that is decided by a local policies, experience and qualification, competence, training and education. Therefore, as a new graduate nurse, I will practice more on my leadership skill to provide the best quality care to my patient in order to achieve the optimal outcome and prevent workplace bullying. To the standard of practice, nurse must follow the standard 2, which is engage the therapeutic and professional relationship. Nursing practice is according to the purposefully involved in professional relationship and effective therapeutic. This comprehends collegial generosity in respect in professional relationship and situation of indirect trust. Moreover, nurse must maintain the relationship in a way which differential the boundary between personal and professional relationship. So I will communicate with the effective and respective of the person of right, belief, value, and culture. Moreover, I will lead and participate in the collaborative practice, report, and voice the noticeable conduct of health professional. To New South Wales Health 2017, CORE value is the important. Collaboration means having the understanding that people within the healthcare system are part of a team. Therefore, I will make sure that I keep in mind the importance of people who I'm working with. Moreover, I will take benefit of change to collaborate with them effectively to provide the best optimal care for patient. Openness means being open about all the facts or issue, including health the rights, and to raise the voice out in discussion about the issue or decision which should be made as one team. Everyone has the right to know what is needed to develop healthcare delivery. Respect means respecting people input, action, and decision and opinion which affect on way care for people. Respecting each and every input, big or small, is necessary because it could facilitate a positive attitude and work cultures would affect the way the whole system running. I will make sure showing respect to my patient and colleagues to maintain a positive environment. Empowerment means caring for patient and allowing them to use the autonomy to manage their care. I will make sure that I develop the therapeutic relationship with patient and advocate for patient by active listening to them to consider option in collaboration with other members of the healthcare team. As a new graduate nurse, I will contribute to quality improvement initiative in workplace and reduce this problem. For example, I have to pay attention to my own response. I must be aware of my own feeling, response, instinct, and sensitivity, for example, flight or fight. respond, and as well as be aware of the way I express myself. Moreover, I will seek feedback from my colleagues to develop the quality of care. I would also participate in clinical audit, case review, in-service and mentoring study to continue development my professional. I will encourage other colleagues and to be open about considering potential area which I need to develop. In conclusion, inappropriate behavior, including bullying, are being inspected in healthcare in consequence of the potential negative effect on patient safety and worker satisfaction and well-being. Care setting have a strong leadership can result in multidisciplinary collaboration, satisfactory staffing level, following the code of conduct for nurse, registered nurse standard for practice, CORE value to provide the best optimal care for the patient and prevent bullying by building the effective communication and having a knowledge about being an effective leadership. Here is my reference.